Within the provider community, I think it's still relatively new to people. It hasn't been out there. We haven't been paying incentives for 20 years. It's a fairly new phenomenon. The research we've done clearly points to a lot of opportunity, a lot of upside opportunity for providers. Specifically around issues relating to awareness of the incentives, understanding of the incentives, whether or not the incentives are really motivating. Those are all areas where there's room for improvement, significant room for improvement. An example is across the board, no matter what your role is and what kind of company you work for, if an incentive is paid out very infrequently, and if there's not a good understanding of exactly what you're doing and how that will relate to the incentive, how it will drive either a better payout, you'll achieve the goal and receive that bonus, or you won't. If there's no clear connection and the connection's not well understood, it can't be very motivating. The biggest impact will be physician satisfaction. That's one of the biggest that we hear immediately and hear about most often, is that the physicians will be more motivated, more satisfied. Same thing with nursing staff, for example. The big difference seems to be, again, applying those metrics in a way that people see that they can directly impact them, and that the incentive is something they're aware of, and that it's paid out frequently enough that it's motivating, and they have some ability to track and sort of see their performance. With one organization in particular, I know that it was a matter of fine-tuning over time. It was a matter of realizing that if you wanted to achieve a particular metric with physicians in terms of a particular process or protocol, it was realizing that the staff have a big impact on whether or not the physician can actually hit that metric. And so realizing, wow, it's not enough to give an incentive to just the physicians. In this particular hospital, it was realizing incentives had to be applied up the chain to some of the medical staff. And once that happened, you could see big movement in these metrics, and they could achieve their goals. Whatever the goals are that you're trying to achieve, incentives can be a powerful motivator. That's why they're used in so many other contexts. And I think within healthcare, we're paying for those incentives, directly or indirectly. Whether or not we're getting value from that money, whether or not it's being done in a way that it's worthwhile versus wasting the money, that's the question I would ask. And I see a huge opportunity there, huge opportunity.